Welcome back to the Startup Show. I'm John Biggs. Today on the show, we have Sylvia Kang. She's CEO of Mira. Mira is a hormone sensing company, right? You guys are building devices for that.
Yeah, so we're a hormone testing company and we build a
Hmm.
device to test hormone from home.
Okay, so tell me about that.
Yeah, sure. So Mira is it's for women to understand their hormonal health. So we started about 7 years ago, and we built a home testing device. And this device can test from a urine sample for women going through different fertility stages. So such as when they're trying to conceive and after they got pregnant and menopause, managing PCOS, managing hormone imbalances. All these stages are having a really high correlation, their health status having a high correlation with the hormone balances. But before we started Mira, like a few years ago, there was really no product trying to understand the women's health in that depth. So usually if you're trying to conceive and you purchase the ovulation predictor kit, which tells you a one line or two line answer, and that's not really for long-term tracking, and it's really confusing for a lot of women. Or if you don't get pregnant after you pass the 30 years old, you go through IVF. And that's also a very painful and super expensive process. So Mira was really trying to play, in between. So to have a tool for women to test their hormone at home, and it's continuous testing. And we provide a quantitative answer for every hormone you test, just like what you get from a lab test, traditional blood drawing from the lab. And also this continuous data, give very many insights, like how your cycle is regular, how the cycle is compared to the previous cycle, or so on. So there's a lot of medical meaning behind that. So by this way, you will have a really clear understanding about your hormonal health in general, not just trying to conceive, not just the ovulation, but in general, maybe there's some hidden issues that's affecting your ovulation, affecting your cycle health. And your doctor can see the data from the back end. So that will also give a doctor like this continuous hormone data they have never got access before.
And how does the process work? How does the product work?
Yeah, so the we sell the product directly to consumer. It has a monitor, so which is the like a reader for the hormone test ones we offer, and it has comes with multiple hormone test ones, and we test the LH, estrogen, progesterone, FSH. So those hormones are like understanding like when ovulation happens, when ovulation about to happen, if you have already ovulated, and also understand your like menopause stage, like how much egg reserve you still have. And then the user will sample the test wand into the urine sample, and then stick the wand into the test
Oh, okay.
the analyzer's monitor, and it will read into a number. So it's going to be a hormone concentration number, and this number will be transferred to the Mira app. And in the app, it will interpret the data for you. It will plot that for you, so you can see entire cycle how your hormone goes up and down, multiple hormones, the ratio between them, and you can see comparison to previous cycle. And we also, since we already have more than 1.3 million data points on this device, so we compare your data to your like population group average, or like a healthy population group average, like someone maybe in your age or under similar condition as you, and you will say how your hormone looks like compared to them. If there's any red flag, we'll also remind you.
Okay, interesting. I'm fascinated by the constant updating. And you have a million and a half, you million and million point three like data
Data.
points of people who have just used the product, and you can basically compare yourself. So what has all that data given you in terms of insight?
Yeah, exactly. That's really the most fascinating part about this. So it gives a lot of information. So first, we start to realize our cycle has so much variability. When I started Mira, there was no such a thing, in the world. So we had to develop the algorithm from the beginning, right? So we look at the Wikipedia, and the Wikipedia show, well, here is a standard curve, and you're supposed to ovulate on day 14, and you're supposed to have a cycle about 28 days, and here's a hormone range. And when we started to test the real user hormone, and we found our body never function like that. So it's probably 95% of people having higher, lower hormone earlier or later ovulation, and their hormone ratio is very different. So basically, the things we know today are very theoretical because there was no research, very limited research about the women's health was done, and there was almost no research about continuous hormone tracking, hormone profile, what they
Hmm.
mean to the health was done. So people just have a just like say, okay, here's the average. You're supposed to be in that way, but that's really doesn't apply to anyone. So we found that variation was huge, and also interperson variation was huge. Even intercycle variation was huge as well. And we
Interesting.
also found that the hormone is affected by your lifestyle and affected by many things. And that one is also very limited research was done on that either. So the seems like people only understand so far, like, okay, you're 35, you have to go through IVF, but the 35 it sounds like really like a magical age, and that's wrong, because nothing really changed in your body dramatically at the age 35. And for example, you had a poor health condition, maybe you were having a very stressful lifestyle for a while, and maybe during this time and your hormone become more irregular, and you have we also ask user to log in their symptoms too, so we have that information as well. And then you will say they log like symptoms, they don't feel well, they don't sleep well, and they're stressed, and all these affect the hormone. And however, sometimes this can come back as well. So if they start to have a better lifestyle and their entire the body really works as a whole thing, and they will come back and they'll have a more regular and a normal ovulation or so on. And we also found the everything's connected together. It's not like when the market a few years ago was only selling ovulation predictor kit, it was like ovulation is a thing by itself, but that's a totally wrong concept. So ovulation is a result of many other things, like your cycle regularity, your age, and lifestyle, as I mentioned, and also like how do you manage your cycle? Like many people know, like they observe their body, they understand when they're about to ovulate, they have other symptoms like a mucus whatsoever, and that also help you to understand better about when ovulation happens. Yeah, so it's really like a whole thing. And then now we started to launch a product about menopause, and we see the same thing too. So there's a correlation about how regular your cycle is, and to when menopause is about to start or so on. So basically, there's still a lot of research needs to be done for sure, but based on our observation from those raw data, we feel like there's so much information over there. So your body really functions as a whole thing, and your life stage are not separate. From a even you're from a
Hmm.
like when you're trying to conceive, and you probably went through something like a birth control, you came out from birth control, you go to menopause, and all these are related together. You can't really just take ovulation itself to say, I just don't ovulate. I don't ovulate regularly. I need to resolve this. To resolve this, you need to understand all the story behind that. Also understand your lifestyle, understand your group, which age, like a lifestyle or like a stress, diet, sleep, all this group you belong to, behavioral group you belong to as well. So there's a lot of factor coming into play here.
Now, is this considered a medical device? Is it licensed for that, or what sort of information can you provide without kind of encroaching on the medical profession?
Yes, this is a medical device, and every product we sell on the market is FDA compliant.
So you're able to say this happened, so you should consider doing X.
Yeah, so we are able to say that the based on your hormone, we know if when your ovulation should be, and if your ovulation has already happened, progesterone can confirm that, and we can also say that the are you close to menopause and which stage at the menopause you are, and those are the basic things we can tell you. We're not like a diagnostic company, we're more like a tracking company.
Hmm.
However, based on that, we provide so much education to the consumer. That's what the consumer needs, and that's also what we usually ignore from the healthcare system. We only think about, okay, this is to help. It seems like we only talk with doctors, say, hey, how do you help me to diagnose something? What is a diagnostic protocol? But you don't talk about things we don't know, such as as I said, lifestyle and age. Those things really are the main drivers for your hormone change whatsoever. Diagnostics is really the last stage, when the disease already happened, and then we really have nothing to do. We say, okay, you take a drug to put your body, to a balance whatsoever. Like for IVF, for example, well, you don't even, it's not really the treatment. It's more like a, methodology. You really can't get pregnant, your egg quality decrease. So I use something manual way to help you to fertilize that egg. It's more like that. But this
Hmm.
is not really treatment, and this is more like a last step. But we
Hmm.
always ignore all the steps before that, and which are the real causes and the real improvement you could do for your body to get better. And another thing is like we don't really talk to consumer. In the past we never talked to a consumer. We don't provide them education. And for example, now at Mira, we give them the data and we also give them so much education as well. So we provide them articles and all these are personalized and we give them the tips like what you should do on this day. Maybe your stress level is getting too high or or hormone is irregular. You should see a doctor or your ovulation is earlier, later, and you should try to conceive earlier or later. And maybe you're having early menopause, your egg quality is not good. So in that case, you just have to go to IVF, and you better to go as soon as possible. So things like those, and those things are like beyond what traditionally a medical device claims, right? Because
Hmm.
medical device claim, I think, is really talking to doctors, talking to the healthcare system. But as a consumer, we all need more than that. We need the knowledge, we need the understanding for ourselves. We need to own our data.
Now, aside from the obvious fact that this is like really vital information, what's your marketing plan? How did you all market these tools to people?
Yeah, so we have a lot of channels to do that, and we mainly sell directly to consumer, and it was a huge success for us. It was a surprise to me. Our consumer actually do understand their hormones, and when I launched the product, I was worried like this might be too technical. We're talking about hormone names. We're not talking about very something really obvious like, oh yeah, you got pregnant or not. We're talking about, oh, this hormone's increasing or decreasing. You have regular pattern or not. But surprisingly, consumers have a really good understanding. So we had a very big success over there. And we also have, a lot of, communities, talking about this product. Like we have an integrative medicine doctor, we have many influencers and, many like influencers in, even in like more like a fitness and healthcare and fertility, life and beauty, that kind of style in that segment. And at the same time, we have doctor support as well. So we work with some IVF clinics, fertility treatments, and they are testing Mira in their as a part of their IVF process. During the IVF process or IUI process, it was very painful for the patients to go to do blood drawing all the time. Every time they have to drive to the clinic, and the blood drawing takes only 30 minutes, and they
Hmm.
drive back, and they have to take half day off. And by testing Mira, they can have constant monitoring. They don't have to do this, and it's saving a cost for both the patient and the doctor. And also the nurse can see the data from the back end all the time, so they will never miss that ovulation.
What was the most difficult part of building this business?
Yeah, I think building any startup is a challenge, and for Mira, for sure, we have gone through many, many different challenges. It's an ongoing challenge. I think the most difficult part is like when I started Mira, I did the transition to myself. I realized that I had to learn everything from scratch, and it was like there was no information given to me. So before I started Mira, I was working in a really big, like a Fortune 500 healthcare, not healthcare, like more like a life science company. So like the lab consumables, and that was a great company. But in a existing setup, you pretty much have everything, like all the process, all the resources over there. For example, I want to do some customer VOC, like a voice of customer, and I can ask a sales team to do that. But when I started Mira, there was no sales team, and even like the first customer will say, where did I find that? Who wants to talk to me? And those are questions. And I thought that was just the beginning, but it was not. So everything we do, we're trying to, we're growing really fast now. And it's something completely new. Like for example, how to build a team afterwards, how to build a marketing team, how to build a content team, how do you talk to a doctor, expand to a different channel, and how do you do new product innovation. And the new product innovation at the early stage of a company, it's like you hire a product manager and you work with that person really closely. But now it's not possible. You need to have a process because you probably have multiple product managers. You have many products on the pipeline. You need to build a pipeline. So that process,
Hmm.
and I cannot get involved that much either. So it's really a ongoing process. And every time, every step we're taking is completely new. I think that's a part many entrepreneur or early stage, I would say early stage entrepreneur they really likely to fall into the pit hole. It's like I assume I know this, but actually you don't. So I think the thing here is like first you have to really be aware what I don't know. Many people don't know what they don't know. They think they know it all. And the second thing is like you have to be really resourceful and to find a way, methodology to learn about anything. There's many articles online, and there's people waiting to talk to you if you just ask a question. And you can also find the consultants, or you can hire in the employees. Obviously, all this will cost money, so you have to structure in a way that's really efficient, it's manageable, it's efficient, but will also get your questions answered. That was a
Hmm.
really challenging part. Yeah, it was different from when I was working for someone else. That was a totally different mindset and totally different process.
Perfect. All right. So the website is miracare.com, right? So people can go to
Correct.
there and actually buy the product and start testing right now.
Yes, exactly. You can go to miracare.com, and you can also follow our Instagram and Facebook, and all these social media accounts, YouTube, TikTok, and those handler is the Mira Fertility, Mira Fertility.
All right.
And
Mira,
you
killer.
can also sign up on our website, and we have free newsletter all the time. We have free webinar, and so completely free. And we have ebook to download that's also free. And Mira now is the biggest the fertility tracker brand in the U.S. So we're the
Mm,
most influential, most impactful, and we also are expanding into menopause. And we last year we launched the clinic as well, virtual clinic. We realized our users,
mm,
after they do testing, they want to talk to a coach, more like lifestyle coach, as I mentioned, all this thing, right? How what's really driving the change for the hormone? Not like my hormones already messed up. I just use the IVF. It's almost on the other way around. So we have a lot of professional coaches that had a lot of experience about coaching people going through difficult lifetime, and balancing their hormone, improve women's health. So you can talk with them as well, and you can find all this on our website.
all right. Wonderful. Sylvia, thank you for joining us. It's been really interesting.
Thank you so much, John.
All right. This has been Startup Show. I'm John Biggs. We'll see you next episode.